Hi, my name is Felicia, and I'm your nurse practitioner today. I see we recently started you on Enalapril 10 milligrams twice a day to help control your blood pressure. And I just wanted to take a second just to discuss the medication, how it works in the body, side effects, things like that. And I also want to address any questions, any concerns that you may have at this time. So, this medication works by allowing your blood vessels to relax and open, and that's what ultimately causes the blood pressure to decrease and reduce the workload on your heart. This medication is, of course, an oral medication. You take it by mouth. It's broken down by the liver and absorbed through your GI tract, which is your stomach, your intestines. Okay, and it's eliminated through your kidneys and your feces. So whether you're going number one or number two, you're not holding on to that medication. You're actively excreting it throughout the day. Okay. Common side effects that we see and that we hear, you may experience a nagging dry cough, electrolyte imbalance, low blood pressure, and dizziness. Most common is the dry nagging cough. And more severe side effects that we monitor for is angioedema, which is just swelling to your face, and that swelling can travel down your neck, your throat, anything like that. So, if you begin to experience this facial swelling, you need to seek medical treatment as soon as possible, like right away, go to the emergency room. That's very urgent. And another severe side effect is kidney impairment. And we'll touch on that a little later. Okay, and this medication, we use it in the pediatric population and the elderly population, but I just want to talk about the pediatric population really quick. So when we dose the pediatric population, it's based on their weight. And we keep a close eye on that dosage. We don't want to make them too hypotensive, which is just extremely low blood pressure. And we want to make sure their kidney function is staying at baseline or as close to baseline as possible. And so we just monitor their vital signs and their lab work and their kidney function, electrolytes, things like that, really, really closely. Okay. And so, basically, the same considerations go for the elderly population also. And with the elderly population, we usually start their dose off pretty low and titrate as needed because they're older, they're at a higher risk for age decline, and that's something we don't want to steer towards. We want to avoid that at as much as possible. So we keep an eye on their kidney function, their electrolytes, their vital signs also. Um, and a big one with this medication in the elderly population is monitoring their potassium levels. We do not want them holding on to that potassium, um, which can lead to cardiac issues if their potassium is too high. So, we like to be extra mindful if they're taking a potassium sparing medication or a potassium supplement. We like to dose appropriately and modify their medications as needed. And with the older population, they're also more likely to experience orthostatic hypotension. And what that is a drop in blood pressure when changing positions. So, for patients experiencing those symptoms, we encourage them to change positions slowly. So, if you're lying, you before standing up, sit for a minute or two. And once you stand for a minute or two. Don't try to move. Just let your body adjust. Okay. Um, and this medication it is contraindicated in people who has a history of angioedema. Again, that's that facial swelling. It is not recommended that we use this type of medication in that population. And also, we avoid this medication in pregnancy. This medication can be fatally toxic to the baby. So, if that person ever plans on getting pregnant or working towards getting pregnant, become pregnant, we do ask them to notify us as soon as possible so that we can find a new medication regimen for them, find something that will work. And also with this medication, because it's used to help control your blood pressure, we do recommend that you guys stay away from medications we call NSAIDs. Which is nonsteroidal anti-inflammatory drugs, ibuprofen, naproxen, things like that. We encourage you guys to stay away from those medications because they have a tendency to reduce the effect of antihypertensive medications like this. Um, so yeah, and that's the medication in a nutshell. And for you, I would recommend monitoring your blood pressure before taking each dose. I will give you blood pressure parameters for you to follow. And that's it. Any questions, any concerns?